Thank you, Mr. Speaker, sir. Honourable Speaker, members of this August House, distinguished guests, members of the public virtually viewing this parliamentary session, good afternoon to you all. Mr. Speaker, sir, allow me to brief this August House on an issue that needs a coordinated, multi-sectoral public health response. Working very closely with the National Committee on the Prevention of Suicide, we will be commemorating World Suicide Prevention Day on Tuesday, 10th of September, with the launch of the Suicide Prevention 2024 theme, Change the Narrative, with a call to action, Start the Conversation. I am respectfully starting this conversation with you here in this August House and across the nation, with our viewers across the globe. We need and must work together. According to the World Health Organization, approximately 800,000 people die by suicide every year, which means 1 for every 40 seconds. For Fiji, the suicide and attempted suicide statistics gathered by the Fiji Police Force in the 6 years from 2016 to 2021 revealed a total of 1,276 suicide and attempted cases, an average of 213 cases per year, with about half the number leading to deaths. The highest number of suicide and attempted suicide cases were recorded in 2019, with 244 cases, and the Western Division recorded the most cases every year for the 6 years. Changing the narrative on suicide is about transforming how we perceive this complex issue and shifting from a culture of silence and stigma to one of openness, understanding, and support. The call to action encourages everyone to start the conversation on suicide and suicide prevention. Every conversation, no matter how small, contributes to a supportive and understanding society. By initiating these vital conversations, we can break down barriers, raise awareness, and create a better cultures of support in our churches, our mosques, our sporting fields, cover sessions. Let's start this conversation. Mr. Speaker, sir, WHO Comprehensive Mental Health Action Plan of 2013 to 2030 underlines suicide as the second most common cause of death among young people in the ages of 15 to 29 years across the globe. Every individual suicide has far-reaching emotional, social, and economic consequences and deeply affects the families, local communities, and nations across the globe. I am inviting members of this August House, your ministries, and everyone listening and watching this session, please wear a yellow or orange article of clothing, wristband, hairband, on Tuesday, 10th of September, to indicate that you are advocating that life is for living, that a life lost to suicide is a life too many. I call on my colleagues on both sides of the House to get your staff and students, teachers, and families, all civil servants to wear orange, yellow on the day, and on most days to help advocate for suicide prevention and save a life. You can also join us on Tuesday, 10th of September via the live stream on Ministry of Health and Medical Services social media page at 8:30, and also at the evening, a candlelight vigil from 6 to 8 p.m. at the Ratu Atonio Lalabalavu. I thank you for the opportunity, Mr. Speaker, sir.
Thank you.